can address. And it all has to do with the cost of drugs and how we provide these drugs. So making more generic drugs available where it's appropriate, as you heard, is very important. And something else that I strongly support is giving the federal government the ability to buy prescription drugs in bulk, such as they do with the VA. Now, this was denied under the original legislation, probably for a whole variety of reasons. I don't know what the exact cause of it was then. But this is a common sense proposal, because if you can buy in bulk, I mean, if you can buy 1,000 of something as opposed to 5 of something, you're obviously going to get a better price if you're buying 1,000. So if you're buying 10 million of something, you're going to get a much better price. And all this malarkey that we can't do it, the arguments why we shouldn't do it, I think they're all on the wrong track. So as this health care proposal unfolds, we're going to be watching very carefully. I want to make sure that the final bill that gets signed into law is something that will truly make a difference in lowering health care costs for individuals like everyone in this room and for small businesses that are suffering, that it does something about the uninsured, that it continues to look after our children. And this was an initiative that President Obama moved very early, children's health insurance. AARP got involved because they understood that this was something that was important for our nation. And I was very happy to support the bill in the last session. Unfortunately, President Bush didn't support it. I voted to override his veto. We weren't successful. But that bill was signed into law by our current president and will help an awful lot of children and an awful lot of children here in New Jersey. So that's one initiative that really we've started with and makes some sense, but we need to incorporate a whole lot more as we move forward. I hope we get the opportunity to be able to look at a piece of legislation that we're going to be asked to vote on and be given more than 10 hours to look at it, and be able to get feedback from those who are closest to the issues, like AARP. Ideal circumstance would be that a bill would be made available sometime in the very near future, next week, within the next couple of weeks, and we as members of Congress would be able to take it to our constituents, all of you, have you look at it, and have you tell us what you like and what you don't like, what works and what doesn't work. And then Congress has the opportunity, or should have the opportunity, to be able to modify what has been proposed to make it into the best possible product for health care in the United States of America before the President signs it. This business about giving us 1,000 pages and 10 hours to look at it and a straight up or down vote is not a way to run the trains on time. Now, I'm hopeful that that isn't the case, and I think most of my colleagues are hoping for that as well. So we don't have a lot of information, but we have some basic principles, and we have some very good people who are involved. I'm meeting with a lot of healthcare professionals. I'm meeting later on today with folks from hospice from all over South Jersey to get their input. Been meeting with our hospitals. There are rumors this plan as proposed is very, very expensive. We don't have the exact price tag, but it could be in the $2–3 trillion range. And how this gets paid for becomes very important, because in talking to our hospitals, if the federal government comes after our hospitals to pay for this, we've had 2 hospitals in New Jersey close in the last 6 months, one of them in our district, Kessler. And we have 80% of our hospitals that are running in the red. So if the federal government attempts to come in and say to our hospitals, we want you to pay more, we're going to have more hospitals in trouble. And the hospitals that we have, our hospitals that are doing a great job and doing well, are going to be forced to make cutbacks. That's not a good thing if they have to cut back personnel, cut back nurses, cut back programs. AARP has been a leader in outreach programs, helping you to understand how to live a healthier lifestyle, how to stay out of the doctor's office, how to stay out of the hospital. That's the first line of defense. That's the most cost-effective of all if you don't have to go to the hospital or the doctor. Our hospitals have partnered with you in making community-based healthcare initiative and programs educationally available, effective, bringing them into the communities. So if hospitals have to cut back, this is not a good thing. This is not a good thing. So it's a comprehensive plan, it's a huge initiative, and it will take all of us really focusing on what the right thing is to do. The second initiative, the Complete Streets that you heard about, is something that I think is going to take place a little bit later on this year. Every 5 years, the federal government looks at the Transportation Trust Fund for the United States of America and reauthorizes a bill that puts us on a 5-year plan. It's one of the few areas where New Jersey gets back something close to what it sends to Washington. We get back about 92 cents for every dollar that we send out. And our goal is to raise that up to 95 cents. Now last time we did this 5 years ago, New Jersey made out pretty well compared to some other states. In mass transportation, we had a 50% increase over the previous bill. And on surface transportation, roads, bridges, highways, we had a 30% increase. So we're looking to keep that track record going. But when they look at this bill and what it encompasses, they take a lot of other ideas that have been laid out there for transportation, and Complete Streets is one of them. Complete Streets is a piece of legislation that was introduced by a congressman from California, Congressman Matt Suick. And I fully expect that when we debate the Transportation Trust Fund Reauthorization Bill, that this idea for complete streets so that pedestrian and bicycle access allows for more safety when roads are constructed or when roads are reconstructed, that this is taken into consideration in the design phase to make it safer, to make it more accessible, and I think that this is something that is very doable. So they are two of the initiatives that we are working on. Now, one initiative that I was very happy to support, was signed into law last week, was the credit card reform bill. And I'm sure if we went around the room, each and every one of you would have a horror story about a credit card abuse from a company with either you, your family, or someone that you know. And clearly there have been numerous abuses, and this was a wonderful step in the right direction. I applaud the President for this. I was happy to work on this. I was happy to vote for it, happy to see it signed into law. And simply what it says some common sense things. That when you get credit card information, it's got to be easily understandable. That you don't have to get a magnifying glass out and read the fine print that's on the reverse side that's written in Swahili or Chinese. That what they're telling you has to be understood. That what they're telling you has to be constant and stable. They can't lure you in at one rate and then arbitrarily in 30 or 60 days raise that rate up. Things that, what they call predatory lending practices, that this will help put a halt to. So this was a common sense proposal that I think makes sense for all of America and certainly makes sense for AARP members. Many other topics they're working on, but one of the big reasons for doing the forum like this is for me to be able to hear from you, to hear your comments or to hear your questions, and I am happy to try to answer what may be on your mind or to comment on a topic that we may not have referred to.
This is a suggestion, not a question, but one of the things that keeps octogenarians and up going are, one, good genes, but secondarily, physical activity. And I think if we can organize, to some extent, walking or things like that, that would be very, very helpful to these people. And I think you ought to think about that when this bill is put together.
I don't think anybody would disagree that keeping active and exercise is a good idea. I'm not sure what role the federal government would play in pulling that together. I mean, individual communities have, some communities have access to areas where folks can walk. There are some folks who get together at malls and do that. Some